Hello, I'm Dr. Roberto Carricchio. I'm the chief of the Division of Rheumatology at UMass Chan Medical School in Worcester, Massachusetts. And I'm also the director of the Lupus Center at UMass Chan. I'm joined today by Miss Ruth Wilson, who's a patient with lupus, but it's much more than that. She's also a very strong advocate at the national level with a number of foundations, and also the director of our lupus support group in our center. Ruth, welcome.
Thank you so much for having me, and thank you so much for that very gracious introduction. I really appreciate your invitation to be here today.
So, well, thank you. That's very important, your presence. So why don't you start with telling us about your journey to when you were diagnosed with lupus?
Well, my journey to a lupus diagnosis was fraught with challenges and uncertainty. Over 6 years of unexplainable pain and debilitating symptoms that led me on a quest for answers. Despite seeking validation from a lot of different healthcare professionals, my cries for help often fell on deaf ears, or it felt like anyway. It wasn't until my kidneys got involved that I actually got a diagnosis of systemic lupus erythematosus and lupus nephritis, and I had just turned 30. And the way this whole thing started was, I was having a lot of unexplained symptoms, fevers. I gained weight like very, very quickly. I was gaining like 2 pounds a week. I was having like, my face would be paralyzed some days, like my eye would droop. I had ringing in my ears. I had a lot of bruising. And then I started noticing a lot of back pain, and then my urine was frothy and dark. And then that's when I decided, even though I was trying to go to a rheumatologist at the time because I was having a lot of joint pain, I just decided to take myself into the ER because I felt like the rheumatologist I had at the time wasn't really, he still hadn't given me a diagnosis for lupus. And so then I just went to the ER and said, please check my urine. And sure enough, he came back and told me that I had nephritis and that I definitely had lupus. So that's how it all started.
Well, I'm sorry to hear that we do know, though, that you are a very typical patient, meaning that diagnosis of lupus often takes several years before it can be discovered. And that is also for rheumatologists. And you seem to have gone through a very typical story. And if you have to tell something as a tip for patients with lupus, when they are newly diagnosed, what would you recommend? What should they do?
Well, to a newly diagnosed lupus patient, I would first and foremost offer words of empathy and encouragement. It's a very hard thing to find out that you have this disease that there's no cure for, right? And that it's going to change your whole life. So I would emphasize the importance of self-compassion and self-care while trying to navigate the complexities of this disease. I think it's essential to seek support from not only your loved ones, but from support groups and your healthcare professionals. And then another thing it's super, super important is to educate yourself right away about what this disease is, what the challenges are, and what the treatments are out there, as well as the research that's going on. You have to become an advocate for your needs and be prepared every time you go to the doctor to ask questions and to be sure that you are empowered to ask those questions, right? So really educating yourself about your disease becomes number one priority. And you need to remember also that you are not alone in this journey. there's hope amidst all these challenges. And like I said, you really need to find a really good support system, because I know that it can be very, very lonely at the very beginning when you first get diagnosed.
Those are all excellent points, and very true, very true.
Thank you so much for having me. This was a very useful information, that I hope helps other lupus patients. So thank you so much for having me.
Thank you, and let's thank also the audience that has joined us today to listen to us, and especially to your story. Thank you very much.